public offices and everything. Our percentage, people are still getting vaccinated, and the percentages are going, and the disease is on the decline. And so we're getting back to some semblance of normalcy. We're having some of the events, as you know, the cricket is here, and for mostly vaccinated people are allowed to come in, and the few who want to be tested before have to come in with a negative test. So things are happening, and we're relaxing the protocols. A lot of that is happening because our numbers are so substantially wonderful numbers so far, and there's zero admittance to the hospital, and there is one of the last updates, which is about a couple of days ago, was just 6 positive cases, and those are people with basically flu-like symptoms or even totally asymptomatic, which is what we're seeing worldwide. So our data is mirroring most of the other countries in the world, and so things looks good. Things looking a lot better, and protocols are being dropped all over the world now, and people are moving forward because the Omicron seems to be more like a flu symptoms, and if for anything, no symptoms at all.
Could it be in part, Doc, be attributed to the fact that more persons have been now fully vaccinated, and consequently, when we started out, we were speaking about herd immunity, and we attach a percentile amount to it. Could it be that it is that which is in effect basically, but the percentile number needed to be higher?
Yes, I think, and that's what we're seeing as more and more people go out and get vaccinated. That's one thing. Also, Weber, vaccination, which is, one of the ways we do get to herd immunity and the natural herd immunity. One of the things that I've been preaching is that the fact that the Omicron is such a mild disease, and people are getting it and they're asymptomatic with carrying of the disease, and because it spreads so quickly and it resolves so quickly, we are also not only the vaccinated herd immunity is occurring, but we're also getting herd immunity from natural herd immunity from the Omicron. So we have a combination of immunity. One, the vaccinated one, along with some herd immunity on board, and so we have very double protection, and that's a good thing. I mean, we've been looking at the data with the vaccinated, and again, it's a very high percentage in, like in St. Kitts and Nevis. Also in Antigua, we're looking at about close to 70% vaccinated people, doubly vaccinated in Antigua and Barbuda, and so when you look at that, that offers some protection. And again, for the ones who are asymptomatic carriers of the disease, and the people who get it, they also have that additive immunity. So our herd immunity number is very high, and that's very much an attributable fact to what's going on right now, presently. And again, if you notice from where we're coming from back in 2020 December, when we started immunity, the changes in the disease, the changes in the virus, to the point where now most of the disease has decreased considerably worldwide. We're not seeing any more upticks. Remember, we were seeing upticks here and there. All of that has decreased considerably, and I think mostly because of the immunity from the vaccine that's going on, we're seeing these numbers. We can't attribute this to anything else more than the vaccine is doing a wonderful job in combination now with the natural immunity from the Omicron. Even though when we look at the data and look at how long the natural immunity works for, it seems to be very limited, and whereas with the vaccines, it seems to be going for a longer period of time where we're getting good protection.
Doc, to your credit, last time we spoke, you did raise or ask a question, to look at, as to whether or not the Omicron could be a blessing in disguise. And you did point out, well, you did say in fairness, we look at it and see whether or not that after this, it may not be the strain that caused us to, get this immunity, natural and the vaccine, and then we see a sort of almost disappearance of the COVID.
Yes, and that is so true, and I remember making that statement, and it seems like that's what's happening. Sometimes you have to look at the world itself and look at nature and look at God and say all of these things come in the way it's supposed to come, and then that's the way things seem to work. So in disguise or in guidance, it is a blessing in that it's such a disease that it's more flu-like and almost like a cold or whatever. It comes and it goes quickly, and we get that immunity. And I think it's a way. The variants and the variation again, when we go all the way back to 2019, where the virus itself again with the variant jumping species and becoming more effective and more dangerous to the human body, where it never went before, to the fact where it variated from alpha, beta to delta, and then now to the Omicron, which is very mild, which we see happen all the time. This is not an unusual situation, Webber, where viruses just variate until it gets to a milder form. And if I remember, we spoke a little bit about what we call nonsense variation, where it variates and it really doesn't do anything to you. It doesn't do nothing. It just it's a variant, but it is not effective. And here we have an Omicron variant that has changed to the point where it is helping us, in fact, in getting to herd immunity. Important factor, and you are so right in picking back up that statement, and that's where we are right now in that again. And what I say to the general public, there are people out there who has Omicron who is probably spreading it around and you don't even know, and you probably pick it up. You are fully vaccinated and you're now getting added immunity because your body is responding appropriately. You have the vaccines on board and you're getting that extra titer of antibodies against the disease, so it makes it so much stronger and better for us. So we're moving forward and we're progressing with all of this going on, Webber.
Against the backdrop of what you just explained, Doc, I asked about the whereabouts, to put it that way, of the Omicron cousin. A couple of weeks ago we heard that had surfaced, and I was following closely. So based on what you just explained, that can be, a part of it, right? Whereby stuff is still there, but, they get lost in the shuffle, so to speak.
Absolutely, it's a possibility. Again, and you don't even have to guess, Webber, because you saw it in natural progression from the alpha variant to the beta, to the delta, to the mu, the whatever, and now to the Omicron. So more than likely, and what we're seeing is that the disease is disappearing. So the ability, which we spoke about long time ago, Weber, the ability to multiply and variate is a lot less now because of the herd immunity. So in essentiality, we're going to have the disease disappearing because it doesn't have that capability of keep multiplying like it used to in the past, and so more variants are unlikely. But yes, your statement is a possibility. I don't know if it's out there. It doesn't seem like it's out there, and if it is, it's not as effective and it's not doing as much destruction as the alpha, beta, and delta were doing in the past. You are absolutely correct. Again, because in virology, we know that's the nature of the virus. You give it a petri dish, you give it somewhere to live, a human body for it to live, because it needs the cells to live. It will propagate, and then it has the potential of variating, becoming the Omicron cousin, as you just mentioned. And that's a possibility. But the most important thing about all of this, Weber, is that with the antibodies, with the vaccines, with all the medications that we are getting now, it is less likely to vary because we are getting rid of it out there. And so the whole, how much billion people that it used to be able to live in, it can't, and so it's dying out, and it will probably disappear and go into a corner just like polio. Incidentally, they were just talking about the other day a new variant of the polio virus, which was occurring because we had dropped off the vaccination protocols in some places, and so that was occurring. So they had to increase the vaccinations again for the polio to prevent it from going. Remember, the only disease, and for the listening public, that we have ever eradicated completely, the only viral disease would have been the smallpox that we have eradicated completely. The polio is 99% gone. Mumps, measles, and rubella, we're up there in the 85 to 90% of it is gone and we keep it away because of the vaccines. Again, in places, Kyrgyzstan, Pakistan, like we're talking about Ukraine, up in those parts where they had decreased the vaccination level, they found that it started to rise again, mumps, measles, rubella, the MMR, which we do take, and so we see that the disease is rising in those places. So now they had to go back and start doing mass vaccination again of these things. It's so funny, Weber, that the kids and everybody will take those regular vaccines, and now they're like, oh boy, let me not go down that road with this one, with this one. But all of them work the same. They're essentially the same, and there's basically no problems. And we have proven now, remember, Weber, 2 years ago, talking to you, we were talking about blood clots, and we were talking about this, and we were talking about that. Now, people are taking the vaccines. We're not hearing a thing. Nothing is happening. You don't hear nothing. You can understand what the social media has done to the terms of healthcare and preventative medicine worldwide, because now we're not hearing all this double-headed man. You see any of those double-headed babies yet? However, don't know. We don't see these things occurring, and nobody's saying nothing. This thing has really helped. It has worked. The side effect profiles very limited. If anything, it's one of the safest vaccines we have ever made worldwide, internationally, however you put it. It's one of the safest we've ever made. No, and it's effective.
Yeah, I want to look at something, Doc, in the context of what we're speaking about, the vaccines and the COVID-19 and all that. On a different program, on our talk show, Thought That Get Results, we had a discussion on how time fits into everything, and indeed, especially medicine as well. And I was making the reference that when a doctor, there's a reason why when you go to the doctor, based on data and training and all that, would give you a particular prescription or something to amend an ailment or something. But it always applies time. 5 days, 10 days. Can we apply the same big brother time in this particular situation as well as you get data?
Well, Weber, and it's so funny, and yes, we can, and we will have all the data available to give you all the times that you need. It's going to happen. It will happen, and we're going to see it because we're going to continue to do the researches, and we're going to continue to have numbers. The biggest thing, and what is so important, is the statement about time. Remember, we were complaining about how long it took to develop the vaccine. Time was essential. When are we going to start the vaccine? Time was essential, Webo. How long the immunity is going to last? Time was important for that. Do we need a third vaccine? Time was important for that. And so when we look at timing, it is so important that with all the data that you're gathering, that you have to really let the research push its time out. They wanted us to wait before we did the vaccine, but if we did that, people would have died because of time. Lots more people would have been died. Remember, emergency use authorization was something we were talking about. It was timing. We had to look at what the data we're getting and say, how long did it take for the vaccine? Oh, some people saying it was time was too short. When we were looking at these vaccines for over 30 years, from 1975, and we've been looking at vaccines completely, all vaccines, for over 252 years, 1877, 72, 76 was one of the first set of vaccines, over 252 years. So timing is important. So Weber, as we move along and as we go along, time and data will come together where we'll be able to significantly and concretely put down how long this immunity is going to last and for what. We were nervous, we were scared. The science community was like, and every time the disease spiked again, we wanted to give another vaccine, or we wanted to give boosters, and we wanted to that because we just never had the time. But what's most important is the essence of saving lives. And so sometimes you have to bridge the gap between time and life. Look, many a days, Weber, I sit down and, you have a person comes in with an infection and you start the antibiotics, right? And it doesn't work right away, Weber. It takes some time.
Yes.
The patient's getting sick, they're getting worse. And but the antibiotics is working, Weber, but that it's so much bacteria there inside that it takes a while to kill all of them. So the person gets, and you always hear the doctor say, you get worse before you get better. And it's all about time. And so you as the physician have to sit there and watch your patient go through these miserable signs and symptoms, even though your diagnosis is correct and your antibiotics is perfect. It's got to take time for that person to get better. And this is where we were failing along the way with this vaccine and the virus and everything. We were failing because we didn't have time and nobody wanted to wait. People were so scared and worried about life. Now that the disease is retrogressing, it's disappearing, we can put all the data together and come up with something. Yes. And so that's an important factor. With time, we will have all the data out there, which will give us a more comprehensive and complete understanding of where we were in a time capsule, Weber. That's correct.
Now, by the way, you're listening to Dr. Dwayne Thwaites, urologist, and you can join in the conversation if you will. You'd like to make have a question or you'd like to make a comment, you can call us on 469-1700. Doc, as I say that, let me just break away a little, and as I mentioned, Dr. Thwaites, urologist, folks are going to be wondering, when is Doc going to be back here?
Oh, yeah, I'll be back on Thursday. I'll be up at Dr. Gill's office on Thursday afternoon from 12 o'clock. So I'll be in the Federation for the weekend, Thursday, Friday, Saturday. I'm in St. Kitts, Dr. Joy Hoggins' office. But on tomorrow morning, I'll be at Dr. Gill's office by the Social Security building, the government building.
No, so I know that when the heat was on, so to speak, persons couldn't drop in, they had to do an appointment. Is this status the same thing? Suppose somebody just heard you say, well, you'll be in tomorrow, but they didn't have an appointment.
Of course, Weber, they could walk in. I never turn anybody back.
Oh, okay.
So long as it's not another emergency, you could walk in as whenever you're ready. Usually it's just a little packed house, but we will definitely definitely for sure get to you. And I always say I work till the last man standing. Okay, so once you come in and I'm there, I will definitely for sure see you. So you can walk in and see me at by the Social Security building.
Okay, so you're in Nevis tomorrow, Thursday, and also
and Friday,
Friday,
and I'm in St. Kitts all day Saturday.
Oh, okay. So having done that, let's go now, Doc, a little to the status that we are now. But you would caution persons to continue to play it safe, though, because our numbers are down our last couple of charts, 0 and 1 in terms of new infections. You get the feel that when we had those situations arising, you know, when the surge had quelled a bit, people threw caution to the wind. What do you say at this stage?
Well, and very important question is which direction are we going? And again, from your data, I like to take it simple and straightforward. From the data that you have and what we're seeing, I don't know if you guys are having events or going on, massive events like
they have lifted the restrictions and those, so we do have similar to what you described in Antigua. We do have the massive events and so on.
Okay, and so when you look at what's coming out, and again, it's a way of testing what's happening around us. With the events that are going, we're not seeing any uptick, and people are still wearing masks and sticking to protocols. Some people are more relaxed with the mask protocol. I think that, by the time we look around maybe June, July, we should be able to start getting rid of the mask, judging from what your data is showing and what we're seeing from these. And those are decisions that your CMO and all these people are going to be making in a few months. I think yesterday Antigua had a big meeting on how to proceed and how we're going to de-escalate all these protocols and the way how we're going to be dropping them off as we speak. If you have noted, England just get rid of everything. Canada also has done that. But bear in mind, people, when most of those countries, they're almost a herd immunity in terms of vaccination. Toronto had a very good number of the people who are vaccinated, and so was England. Places like Chile, Spain, and all these stuff are almost 80 to 90% vaccinated. And so they're moving to decreasing some of the protocols that are going on out there. Antigua is doing the same thing. One of the things, Weber, that we got to look at with these mass events, and being it that they're making it vaccinated people going to these events, and then they will test the people who are unvaccinated to go in. If we're not seeing, and I know there's some of them, most people are wearing masks, others are not. There are lots of people who just decide, well, we're not going to deal with these masks. I'm fully vaccinated. I trust my vaccine. I trust the fact that I might have had the COVID in the past, and so I think I have enough immunity. So some people are dropping the mask. Those numbers and those events will tell us what we need to do next. How are we going to move forward? We're looking at cricket in Antigua. Remember you had that 2020 in St. Kitts Nevis at that time. We didn't see a big uptick from those events. So with masks and sanitizing and vaccination, we're not seeing the big uptick. So I think we're going to progress to the point by maybe June, August or so, where we're going to see these mask mandates and all these protocols are going to be dropping off, because most of the bigger countries are looking at the data and they are doing just that. And so it seems like we're progressing to the other direction. Again, we have to look at our data. We have to test what's going on outside, the mass events, drop the mask, see what happens, see if the numbers rise. But again, also bear in mind to the general public that we do have asymptomatic carriers of the disease. You have no symptoms, so it's nothing really for you to worry about. But it is still out there. You don't want to contract it. the long COVID for people who get really sick from the disease is horrible. People are still recovering, still fatigued, still have some symptoms from the disease itself, so it's still out there. But the variant that we have now is not causing much destruction, so it seems, and it's a possibility, that we should be looking at lifting the mask mandate in a couple of months from now, which most of the other countries are doing presently, Weber.
You know, Doc, I don't know if you can amplify a little more on those after effects, what they call the long COVID. Now that the surges is, being diminishing and so on, what have you been learning about persons who have had the COVID in terms of effects afterwards and, coming to the doctor with certain complaints and so on?
Yes, and this is what we call the long COVID or the after COVID disease. We do see a lot of people coming in, and these are the ones that were the other variant, whether the alpha, beta, and delta, which was very destructive to the lungs, to the blood vascular system, and so these people are still suffering with early satiety. They get tired early and fatigued very early, just by walking, doing by activities, because some of the lung tissue has been destroyed by the COVID when it first came out, and so we see that. We see some erectile dysfunctions that are still going around with people who have had the long COVID. We still have some people on anticoagulants because of the COVID itself causing some blood clots. We still see some heart disease still going around, and these things are for the long haul. The virus has instilled itself into these people's system and has destroyed some of it. And we also see some people with long-standing neurological disease. The most common complaint, though, of these people is early fatigue. Early fatigue is one of the major symptoms that we're seeing with the long COVID, and then some infertility occurs, especially for those people, and some erectile dysfunction. That's my department, so I'm looking at those numbers too with the long COVID. But the biggest complaint is fatigue, early fatigue. What you're accustomed to do, you're unable to do, and we still have some neurological sequelae, where they still have some limb weakness. Again, some joint problems because they've been sick in bed for so long, it becomes a major problem for them. So this is where we stand with the long COVID disease. The fatigue is the major complaining symptoms of these people who have had the COVID in the past and are now recovering. Again, with the Omicron, it's a flu-like disease. It resolves quickly. It doesn't get to the lungs and destroy the lung tissue like the delta and the alpha and beta were doing in the past.
So it's fair to issue a word of caution, to say to folks, hold on a little longer, to go back again to the point we were making with time, because you still can get it and you still can be affected for the long term.
Absolutely correct. I think that we have seen one or two cases that, remember now, the delta is not completely gone. So you can have people still getting some of the delta variant, even though the Omicron is the most common one that we're seeing now. And when they do get the delta variant is when we see the long COVID and the real bad disease. So we have to still go out with some semblance of caution when we're moving forward with the disease. But there are a point in time, where we have to just bite the bullet and lift all these mandates and get back to some normalcy. And I think it's going to come pretty soon. Next 3-4 months, we're going to be seeing some dramatic changes in some of these, unless we start to see an uptick and a very new variant which is causing problem, which it doesn't look like it's going to happen. The fact that we have almost a herd immunity, and in some places who have herd immunity, you're going to find that the disease just disappears.
You know, last evening we had a person who, as a part of the discussion, asked an interesting question. You know, and I think maybe it might be more of a political decision than a medical decision, but the person wanted to know whether or not they can come to Nevis for a particular event, and whether or not they still have to take the test, etc., etc. So you think maybe down the road then that you know, persons might be able to, in terms of ease of travel, like we used to, maybe don't have to take the test, or maybe don't have to be vaccinated in order to get into a particular country?
Well, I think what we're looking at, and again, this is just my personal opinion, is that I think they're going to keep the travel vaccine mandate in place. I have a strange feeling that's what they're going. Whether or not you're going to be tested is where to travel is going to be most of the changes that are occurring. As you noted, most places are dropping PCR and going to antigen, which is a lot quicker test and easy to go. And as that goes along the line, I think those things are going to disappear, and the mask is going to disappear. So for particular events and stuff, at this point in time, they're still keeping the vaccine mandate for travel. I think that is going to still remain, because we've been doing that vaccine mandate for most of our lifetime, for yellow fever, for this, to go to certain countries, and still the mandate was still there for you to go to college. I think that's going to stick around for a long period of time, and that way, because in essentiality, Weber, I think that's how we are keeping the disease down and keeping it away. The day we lift the vaccines and say we might then have a resurgence of the disease, which is what I prefaced initially when I spoke about MMR and things like that, where they start to drop off, and then next thing you know, the disease rises, and then we have to do that. So I have a strange feeling that with this virus, it's going to probably be the same. So the vaccine mandate is probably one of the things that might be will hold on for travel. I think that the testing is where the numbers are going to decrease. As you see, we're going to the less sensitive test, which is now antigen test. So most places are taking that and forgetting about the PCR. So it's trending towards getting rid of the test, but the vaccine is where it's going to be a major problem, because I don't think they want to drop that guard right now, because it seems, again, from the data, that the vaccines have helped us and has done a good job in helping decrease the disease itself, and to have all these variant changes that have occurred, which has come to the weaker variant. So it has helped us in some way. So I think that mandate might stay on, and that the testing is where we're going to change that, and there will be a relaxation in the travel criteria when that occurs.
You know, Doc, that is very important, because you get the sense that there are a number of persons or anti-vax persons who have been waiting it out to see whether or not in the end they won't have to take the vaccine. But on the flip side of that, they need to travel.
Absolutely.
So maybe that's where we will see the debate going next, in terms of rights and infringements and all that. But let me ask, Doc, as we are getting closer to wrapping up, let me ask this. As we're getting towards exactly that, in terms of the vaccine and normalcy and so on and so forth, from a health perspective, will you continue to recommend some of these procedures and protocols that we use, including the sanitization, frequent hand washing, maybe mask in certain instances, against the backdrop that it is argued, and seemingly the data supported it, and the fact that we were doing those, it helped in terms of other diseases like the flu and stuff like that.
I think it's a remarkable statement, and we had seen a decrease in flu and all this with the mask mandate and the vaccine, and not only within the islands, the other types of flu, not only for the COVID, but for the other flus, the other colds. We've seen a decrease in cold. People are not calling in sick. Maybe they were trying to hide their diseases. I don't know. But we are not seeing that. And so it has helped us. If it's one positive that has come out of all of these COVID is what you are referring to in terms of those things. But bear in mind, we were still seeing a few people who come in with symptoms which were flu-like and who never had COVID too, even with all of these hand washing and with the protocol. It would be nice, but I don't know about the mask mandate. Is very uncomfortable. I think doing proper and clean hygiene has always been the forefront of healthcare. Putting your elbows when you sneeze, trying not to sneeze in public, not to cough in public, to go all of these has been the forefront of healthcare and infectious disease management for all our lifetime. But this didn't just happen. From the first time we start to talk about hygiene and antibiotics and prevention of TB and all these stuff, these things were in place from the beginning. I think it's only customary and it's normal and good behavior to sanitize your hand after touching or doing something. The mask we weren't so much using, but the ability to cough in public was something that we told people that they shouldn't do. These are normal, natural health protective mechanism that was in place before you were born, before I was born. So there is nothing, if we make it more diligent this time around, especially the hand sanitizing. If you have a cold or flu, back in some places they were recommending you to wear masks before COVID, so that when you cough, you don't spread it around to the people around you. And so, your mother will tell you, if you want to cough, move from the table, go somewhere else, or make sure you cover your mouth with your elbows, and all those kind of things. So it's nothing unusual, Weber. I still think that we can continue to do some of these things. I think that the mask wearing is a little bit much because some of us just don't like it and cannot breathe appropriately with that, as people who have other underlying diseases which the mask doesn't allow you to use will have to get away from that. So that's the one that's going to be the tricky one. But the others were always in place long time ago, and we should continue to use those proper and good hygiene, Weber. There's nothing at all wrong with that. And it does prevent other diseases other than COVID. Correct.
And having practiced some of them, at least over a period of time, which are not too cumbersome. For instance, would you recommend like in workplaces, in public places, for instance, you continue the hand sanitizing at the least, because that's not too bothersome, right?
No, it's absolutely not. It's not, and I think that again, Weber, it's not that it wasn't out there. It was out there long before COVID and long before us. So there was nothing wrong in keeping some of those protocols in place. Put the hand sanitizer, keep them on the door. Why you're going to take them back now? Cost you money.
Right.
Let's keep that going. Let's keep some of these things, these nice protocols in place, because we're noticing that people are not going to the doctors for cold now, or these diseases are not spreading. So if that works for us, then it can still work for us now. So those things should be in place. You're sneezing, you have somewhere to wipe your hands you get some hand sanitizer right there. Let's keep that going. You know what I mean? For people who are going to do a handshake, make sure your hands are clean. there are some people out there who have that fetish, Weber, you know. You shake your hand, they're going to go wash your hand. You know what I mean?
Right.
So, yes, those things are essential. Again, as I said before, it is nothing new to us. We had recommended those from a long time. It's just proper hygiene, so there's nothing wrong in keeping them in place moving forward.
Okay, so Doc, not going to hold you back because months longer. And just finally, could you just state where your movements are between the next couple of days, so if folks who are just joining us and probably can get that information if necessary?
Yeah, so I'll be in by Dr. Gill's office on Thursday from around 12 o'clock. 12 o'clock until the last man comes. The last man standing is my principal. And then on Friday, I'll be in the operating room in Nevis. So if there's any problem, they could swing by the hospital up at Alexandra. And then on Saturday, I'll be in the office in St. Kitts from 8 until probably 5, 6 o'clock in the evening. That's my schedule for this weekend, Webo. And then I'll be back in the Federation on the 26th or 27th of March.
Okay.
Again for another stint.
Okay, Doc, always we appreciate your help, your input on these matters. And, as the COVID itself wanes, and I always would mention that we'll get into other topics. But as we continue, and that isn't taking the spotlight so much, we can get into other areas, and so on, right?
Absolutely. We could talk about so many other things. And, I think we're getting back to the prostate screening next January. Nurse Scarborough and the team is getting together, and we're starting to do some movements in terms of that. We're looking that we might be able to do a screening in June, in the end of June in St. Kitts. We're looking to see how that might fare out, depending on what the protocols are. And so the doctors are all ready, and we're psyched to go. We've missed out on just about 2 years of screening, and I must say thanks to most of the men who come back to the office and say, look, I want to be screened because I know it's been 2 years, and we know, I'm going to come in and then let's help you going, and let's continue with this screening process going on a yearly basis. So thanks to those people who come in and offer to move forward again. So we're looking forward to next January. I think it's going to be January 10th or somewhere around there. And then we're looking at probably, if the mandates and if all the protocols are more relaxed, that we might be able to do a screening in June in St. Kitts. And we're looking at Antigua in August, and then back to Nevis in January.
Okay, but
bear in mind, Weber, that Nevis was the only country that got their screening done in 2020.
Right.
They were the only island that was able to get prostate screening.
Because
they're going to be missing this year, but it still works out to be just fine.
Because it came under the window, you know what they say.
Yes, we did.
The old folks say early birds, because we were early in the year. But you mentioned something there which was important, very important, Doc. You said, notwithstanding, you're planning to go maybe in January for Nevis if everything works out well. But did you point out in between now and then, though, if you feel the need, you can, contact Nurse Jessica Scarborough, whoever, and get it done in the meantime, right?
Yes, you could come to the office and get it done. And that's what I was talking about. There are men who come in and say, look, we know it's COVID and we want to be screened, and, we're going to continue the tradition. I'll come and see you and get the screening done. So lots of them come in and just say, we're here for the screening, and we know we couldn't get it done because of the social distances and whatever, but we want to be screened. So that's important, that we try to keep up that tradition.
You find, Doc, that as a consequence of the screening and everything over the years that you've been doing it, that men are more now more health conscious. We're probably not there yet, but we're more health conscious, and we take a little more proactive.
The awareness for sure is out there, Weber,
Yeah.
and that's most important. When you can have almost 800 people from a population of 10,000 coming, it's almost 1% of the population coming out to be screened. The awareness is for sure out there.
Mm-hmm.
It's a good awareness, and that's important. So not only for prostate health. So if you come in for prostate health, I mean, you can always have a discussion with the doctor who's seeing you about other health issues, which is so important. One of the things some of the other countries, like in Antigua, when we do the prostate screening, the what they call the national health, the medical benefit scheme, sets up a what we call a wellness center, a clinic where you can go and get your diabetes and your high blood pressure and your cholesterol check at the same time, because the prostate screening draws a lot of men, and so when we get the men in one place, you might as well offer them some other services, because you never know when they're coming back, Weber.
Yeah, that's a very good idea. Yes.
Look forward to in Antigua. We just in Nevis, we just need to get some kind of sponsor, some kind of involvement with another team. So the medical benefit services in Antigua have just set up that big tent, and when you come in to get your screening, they just route you over to get a good high blood pressure check. They do a cholesterol and a diabetes check at the same time. Boom, boom, boom. So you get a full wellness, you get your check for the year, and then they send you back out to the other physician. So it's something that we can consider. Doing.
Yeah, that sounds great. Okay, Doc. Well, we'll see you tomorrow, and we thank you once again, and all the very best to you.
All right, you take care, Webb, and it's always a pleasure. And hopefully, we'll talk about diabetes or high blood pressure or prostate screening in months to come, instead of just the COVID. We're getting over it, and we're moving progressively to safer places and safer times.
All right, Doc. Thanks much
and
again.
Get back on the treadmill, my brother.
Here we go. Well, you get it. Okay, Doc.
All right, later.
Yeah, take care.